I'm Jessica Cohen. I am a professor in the Global Health and Population Department. I sit right there. And I have the profound privilege of co-directing Harvard's LEAD Fellowship Program for women leaders in global health. And as part of that program, I have the profound pleasure of welcoming Dr. Cindy Chantha, to our department and to our school, to the Harvard Global Health Institute. As part of that program, she is here for a month. Anyway, I won't drag on about the program, but it's a phenomenal program and gives us the opportunity to meet incredible women like Cindy and Jalika, who we'll be hearing from later. So Dr. Cindy Chantha is a Myanmar medical doctor who specializes in public health. Since earning her medical degree in 2002, she's worked primarily in the public sector, gaining a wide range of experience across various ranks and postings in clinical health, public and global health, health administration, and health policy formulation. During her early career as a doctor, she gained valuable experience in mentoring and facilitating a range of capacity building sessions for junior colleagues and healthcare professionals stationed at the grassroots level. She's played a significant role in formulating a national health policy, a crucial step toward achieving universal health coverage. And in her most recent position in the public sector, she served in a director position, providing technical expertise and guidance for health system strengthening. Despite transitioning away from her professional life in the public sector, she remains committed to serving vulnerable populations, as you will hear shortly. Dr. Chantha co-founded and led a nonprofit organization in Thailand aimed at addressing pressing healthcare needs, providing humanitarian assistance, and offering emergency relief. The organization has proved significant progress and achievements during the 2 years of her leadership toward health, humanitarian, and development assistance for displaced and migrant populations at the Thai Myanmar border. She has moved to the United States. We're very lucky, enhancing her professional and leadership capacity to work for the most needy population in her country, as well as all over the world. She and the other LEAD fellows will be around for many activities this month, and we look forward to getting to know her and her work better. I would like to just disclose that speakers' remarks are based on their own scholarship and experience, and as such, they speak for themselves and not for Harvard. With that, I will let Cindy take it away.
Thank you so much, Jessica, for your introduction. So good afternoon, everyone. So thank you so much for joining today's section, everyone in this room and then from online participants. So it is my great honor to be here to share the humanitarian crisis in Myanmar, insights from displaced public health professionals, a very strong academic community here in Harvard. So I'm so glad to be here. So thank you so much, Harvard Global Health Institute, Harvard T.H. Chan School of Public Health, for giving this opportunity for me to share with this situation. So I have to change the topics a little to better reflect the contents within the limited time frame. I like to confirm that it is not a country presentation or research or academic presentation. Some of you may not much interested about it, but I will try to share with you about the different world from here with the next 30 minutes. I have framed the points within this outline: country situation, Myanmar and health status, challenges in the country system as part of changes of the military coup, and the attacks on the healthcare by the military, which impact on the health and humanitarian situation in the country, and also founding an organization to fill the gaps in the health and humanitarian sectors, and my leadership journey, and finally, devastating outbreak. So many of you may not notice Myanmar, but some of you well know about Myanmar and then worked with Myanmar professionals. So it is a country in the Southeast Asian region between two populous countries, China and India, and with long border with Thailand. with population of 54 million and life expectancy is 66 years. After decades of military dictatorship, Myanmar has experienced lowest level of health indicators, unachieved Millennium Development Goals, and highest out-of-pocket expenditures for healthcare. But after 2016, with the democratization, country has shown some improvement, including health sectors. So before coup, this is the data from 2019. So maternal mortality rate is 179 per 100,000, under 5 mortality 41,000. Neonatal mortality rate 21, and doctor population ratio is very low, 0.4 per 1,000 population. Immunization coverage, when we look at the third dose of GPT, is 84%, and measles coverage is 91%. It has improved a lot within 5 years of very low coverage in immunization. We have some on-track efforts for 2021. So immunization program and disease control programs like HIV, TB, and malaria is great achievement remarkably in the region. And we have country goal of universal health coverage 2030 already set up with series of national health plan. And now we are the people of the country who got the vaccine, COVID-19 vaccine earliest in the region. And then least mortality in first and second waves of the pandemic. And then when we look at the immunization program milestones, you can see that remarkable achievement and milestones after 2015 in the democratic government. And what happened next? In 2021, the military coup on 1st February 2021 amidst COVID-19 pandemic. So many of the people, millions of people, went on the road showing their disagreement of the power over the democratic elected government. And government employees, including the medical doctors and nurses and healthcare workers, resisted working under the military, and they joined civil disobedience. We have faced the attacks on the healthcare. So this is the data within 4 years after 2021. So there are about 1,582 attacks on the healthcare. So 135 healthcare workers were killed, nearly 1,000 healthcare workers arrested. They are still in the chase, and then also 358 health facilities are destroyed. And many of the healthcare health equipments and the medicines were disrupted and destroyed within the transportation to the healthcare centers. So this is the data from the insecurity inside, but the actual data will be more than that, we can estimate. So this is the data from the Myanmar witness, one of the airstrikes in hospitals in the middle of Myanmar. So who are the key stakeholders in this situation? So in the resisted areas and ethnic areas, so health professionals who refuse to work with the military, they are the key stakeholders working to save the people in the conflict zones. And then also the Ministry of Health of the Revolutionary Government, NUG means the National Unity Government, composed of some elected people in the professionals, and then also ethnic health organizations and non-governmental organizations, community-based organizations, and some private sector who have worked in the conflict-affected areas and restricted areas. So this is unbelievable. So can you imagine? I think that you cannot imagine a jungle hospital with standard OT. So doing the surgeries with by the FRCS surgeons. So this is the actual situation inside. So they are doing that. Unbelievable. Strong commitment of the CDM professionals and the Ministry of Health and the other organizations working tremendously for the people of. So what are the health impact and humanitarian crisis after the military coup? So the health system is totally collapsed. And then also it is hugely affect on the access and the quality of the healthcare. And health professional health workers are dispersed across the country. Some are in the border areas, some are hiding, some are in the ethnic areas, and then some are in other countries because of the threats by the military. So many stakeholders are considering the new recruitment of the volunteers like MEDIs, community health workers to fill the gap in the health workers. And health infrastructure are insufficient, obviously, due to several attacks on the health facilities. Most are mobile and temporary in the jungle and in the ethnic areas. So although we have some efforts of the malaria control and elimination for 2021, there are re-emerging malaria outbreaks in many areas of the country. And supplies and logistics are blocked. And then there are lack of access to the healthcare, including immunization, so causing unpreventable preventable mortality and increased morbidity. And also management of war injury with disability and mental health and psychosocial needs are priority, and they need more long-term support. And also we have millions of displaced people who need basic needs and access to healthcare and education. Military also restricted to the humanitarian organization, NGOs, so that the people access to the aids and services are very limited, restricted. WHO estimated the magnitude of expected health threats, which is not different from the actual situation. So they predicted vaccine preventable disease outbreaks, epidemics and outbreaks, and then also malnutrition and the great concern on maternal child health, SRH, and communicable disease outbreaks, non-communicable diseases, and cancer prevalence, and also mental health needs, environmental health, and the disasters. The yellow means the median risks, and the red means the high risks. So we have many high risks, and the public health risks are very high across the country. When we look at the humanitarian profile, about 20 million people need humanitarian needs, and 4 million people are IDPs, internally displaced people, and then 1.5 million are refugees. So we will focus about the Thailand border situation, although we have a Western border, Indian border, China border, but we will focus about the Thailand border situation. So there are diversity of population, nearly about 200,000 migrants and displaced people from Myanmar here, Tak province of Thailand. They have poor living conditions and poor working conditions due to the lack of the documentation, and then also about the barriers to the access to health and education. Service providers are already there, like a Thai public hospital and primary healthcare center, but the financial hardship, lack of documentation, and then language barriers are limited their access to health services. This is the country situation and reflecting the displaced community and the people inside the conflict areas. I will continue the presentation with from the point of the displaced profession. So I am also the displaced person who have worked in the government sector, but also I have to run away from the military threat due to the menace to Thailand. So as a displaced person, how I can do for the people? So I have decided to work in a different way. I cannot do in the government sector or the public sector for the people, but I am in the border area, I'm in Thailand, but I can work for the people who are in needs. So there are a new leader in the humanitarian setting here. I founded an organization together with the like-minded professionals and friends to fill the gaps in the health and humanitarian sectors, in the border areas, and inside the country for the most vulnerable populations. So the name of the organization is Four Rivers X Foundations. So there are four big rivers, major rivers inside Myanmar, Ayari, and other brother rivers, which will always running and serving to the people of Myanmar. So likewise, our organization will serve the country in many different ways for the health and humanitarian needs of the people. The motto is Thrive Together, and we have vision of building thriving communities in Myanmar and border areas through equitable access to the quality services for health and social development. There are many stakeholders in Thailand border and then also inside the countries for the health service provision and humanitarian service. So we are thinking that we are not competing or paralleling the work of the other people doing, other organizations are doing. We're just filling the gaps for the people of Myanmar. So I will mention and present about some of the works that our organization has done for the people. So one of the program I would like to highlight is access to education. There are 1 million under 5 children each year to get vaccination by the national program, national immunization program. But after the coup, there are many people, estimated about 60% of those children lack of access to immunization. So we have initiated some small scale vaccination project across the Thailand border to this Karenni area. So it is not a very easy task, but I'm so surprised to see that the strong commitment of the healthcare provider in this state, Karenni state, so they are very willing to get the vaccines for their children. So you may see that the mother and children are waiting for the vaccines, although they have a danger of airstrikes every day. So they have a very willing and strong commitment of the demand generation of the immunization. Transportation of vaccines and immunization are with several means, with boats, with cars, motorcycles, and then also with the walking, the carrying on the backs of the people. But they prepared with the standards of the WHO, and then also there are no adverse effect following immunization, no cases of AEFI after the 3 doses of the vaccines in 3 months. Community education campaigns, screening and immunization, although they are in conflict zone, there are many full standard procedures and guidelines they have implemented. Because of this project, many donors and partner organizations become interested to support in the areas that need vaccination, but it will be small scale, not like the national immunization program, so that there are many still gaps in immunization. Another program is mental health and psychosocial support. So we have created a design to train the community supporter after receiving the training from the psychologists and psychiatrists to support the counseling services to the people from the displaced community in Thailand. So although we can train not much people, but we have selected doctors and nurses who are seeking the job in the border areas. So by getting this community supporter job, they don't need to do like the entry level job like the factory worker. So they are very happy to do like the community supporter, although they cannot use the stethoscopes, the syringes and needles, but they are happy to deal with patients, the community, giving the counseling services to the displaced community. The training given, these are the people, the community supporters. Some are medical doctors, some are senior health assistants, and some are nurses. Another project is access to healthcare by the displaced people by the health insurance program. So there are health insurance company in the Thailand border, but there are monthly distribution and monthly contribution to this program that people cannot afford. So that we supported this way to get access to the healthcare without financial hardship. So after the project, there are some survey findings of you can hear the voices of the beneficiaries that they have suffering a lot, and then also they live with anxiety. Oh, what will be the anxiety seeking healthcare all the time? So with this support, they don't need to worry about financial hardship if their family gets ill. And then one of the beneficiaries said that this project has a novel purpose, and then also they would like to suggest considering to support the people with significant challenges. Another project is prosthetic and rehabilitation. There are many young people who have got injuries due to the conflict and wars. So we have founded a prosthetic production unit within the Meadow Clinic, which is a very known clinic in the Thailand-Myanmar border. So the founder, Dr. Cynthia Mao, she has worked in the Mesa, the Thailand-Myanmar border for 3 decades, more than 3 decades. She has received awards from international because of her tremendous work for the humanitarian works in the border area. So this is the training given by the prosthetic technicians from France and the UK, and then also you can see the people, the patients who got the quality prosthetic, so we can empower their journeys with improving the quality of life. And also, as I mentioned, there are huge gap in the health providers, so that we are training the community healthcare providers. We are the young people from the community. We train them, and then also we supported with some kits. Kits include the provided items to support the community healthcare to the families at the ground level. We are providing care with the maternal and child health, and then communicable disease control, environmental sanitation, nutrition, and assist in the immunization. So we can recruit about 50 community health workers in one region within 6 months. In 2 years of this organization founding, we have some quantitative achievements. So we have provided nearly 2,500 number of displaced people with mental health and psychosocial services. And also we have supported the children to get education, and number of displaced individuals who receive health insurance support is 500. And thousands of children we can support with immunization. And then also we have supported the critical cases, the case management fees for the hospitals on ground. So that is the kind of the financial assistance for the life-saving emergency cases, like the surgery for the abdominal, for some kind of the emergency, like the abdominal perforation, or the emergency injury, or the maternal and child health, like the emergency obstetric care, and then the neonatal emergency care. So we support such cases with the funding. So we can support about 1,000 cases within 2 years. And also number of clients, amputees, people with disability, about 120. So actually, I'm now currently in US. So I have moved from Thailand again. So I have displaced again. So actually, I'm thinking how to continue my professional path and the leadership journey. So I'm now building my leadership skills with the program from the LEAD Fellowship, Harvard Global Health Institute, and networking with other colleagues for the future collaboration. I'm trying to develop my professional skills. And also I'm thinking to strengthen my organization to be a leading organization for the health and humanitarian sector. And also I will try to help vulnerable people who needs in conflict affected areas, not only in Myanmar, but from the other countries across the world. Actually, I plan to stop my presentation here, but as some of you may notice that there is major uptake at 7.7 Richter scale last 7 years ago. So I would like to share with people that is affecting millions of people in the most populous cities. And so there are poor management of the disaster, because up till now, nearly 3,000 casualties, but hundreds of people are lost. They could not be found, and then also emergency services and rescue work are not enough. Although some of the international teams are joining, but many restrictions and limitations by the military caused the people unnecessary deaths and also the delay in saving the lives. So Myanmar people are suffering triple burden. Due to the military coup, they are facing life and death situation every day. And then also from the economy, inflation, and then also the healthcare access and education. So they are suffering every day. and then also such a devastating disaster with no effective disaster management, and using the natural disaster as a weapon and continued attacks on bombing the civilians and hospitals even after the earthquake. So it is suffering a lot. So people are helping people voluntarily, but they have very limited resources. They have no cranes and machines to save the people under the buildings, so that they need help urgently. Although there are some efforts with the people and the revolutionary government, CBOs, they need a lot of resources. So I'm doubtful that as the world hear the voices of the people of Myanmar, so Myanmar people need urgent help from the international community. So Myanmar people deserve to live with safety and freedom. So healthcare workers and health facilities must not be the target for war crimes. And then also everyone has the rights to health. So with that, I would like to express my deepest condolences to the people who lost lives, and then also they also need a lot of help from the people outside of Myanmar, because they cannot do it themselves. And then also, I'm so sorry, I'm so sad, because I cannot help them as much as I would like to, because I am in another country. Also, I cannot help them. So I'd like to acknowledge Harvard Global Health Institute, and then also my mentors, Dr. Anita Shelter, and also my team, board of director and advisor, and other partner organization, donor organization who trusted me to lead the organization, supported my funding, and then also Dr. Cynthia Martin, which is a very big partner of my organization, and then also the revolutionary government, Ministry of Health, and the CDM professionals who are working tremendously hardly at the ground level and ethnic of health organizations and displaced community itself in conflict areas and the people with disability. Thank you so much.
We'll start with questions in the room. And we have a lot of people online as well. I'll just raise one. Thank you so much for sharing your trajectory and for the work that you're doing. So I think you touched upon a little bit on what I was gonna ask at the end. I'm wondering how much your organization For Rivers is or was able to help with what happened with the earthquake, and how do you see your organization helping in the future?
Thank you for your question. So our organization, geographical area is not no boundaries and limited area, so that we are helping the people, border areas, and then also the people in peace. So especially including the earthquake affected area, Mandalay region, Sakai region, and some parts of the Bahulu. So we have formed a group with the community-based organization working in these areas, and then also Meadow Clinic and some organizations provided some funding to our organization to distribute again to those organizations. So we will have a meeting this evening with these organizations, and then we will support them. So because this is not like the formal project, this is emergency, so that we will request the funding, and then we will transfer to the affected areas who are helping the people in these areas with the humanitarian needs, and then also with the healthcare services. The resources are there, but human resources are there, but there needs many helps and other support, like the funding support, like the machinery, like the supplies and the others, that the huge is very big. So, but we can fill the very small gap in this situation. So we are trying to work together with those people who are working on ground in earthquake affected areas. Thank you. And then also another question is our organization plan in future.
Yeah.
So actually our organization has facing the funding gap because of USAID funding shortage to many of the organizations in Myanmar and Thailand. But we have talked with the other donors to get non-US funding with other countries like European and Japan. For example, for the prosthetic and rehabilitation project, we have talked with the Japanese organization to get technical assistance and to get funding for this project. And then also the other projects, we talked with multilateral organization to get funding from the other countries. We are trying for that. Thank you.
Thank you so much for your presentation. I was wondering about the supply chain for things like medications and medical supplies. I'm sure even before the earthquake was very much disrupted, but are people in Myanmar able to get medications, medical supplies, and are NGOs being allowed to assist with the earthquake relief?
Yes. Before the earthquake, the supply chain system is very challenging for the people in the conflict zones and the restricted areas, because although many stakeholders are trying to get the cross-border supplies from Thailand, from India, from China, but it can work in 2021, 2022 because of the military did not block such supplies at that time. But with the time after the military coup, as we go along, we are facing the challenges in the transportation. So military blocked the chains. When the cars are bringing the medical items and boxes, they checked, and then they found the devices and the medicines. So they stopped the car, detained the driver and the staff, and also they are facing many difficulties. So that many stakeholders are trying the alternative ways to get some funding directly to them, so that there are some small shops, drug shops, and then some supplies. So they are working secretly to sell the doctors and the nurses and organization representatives. But there are very, very limited supplies to those areas. That's why the access and equity of health care service issues are very challenging. The people are facing difficulty in getting antihypertensive and then anti-diabetic drugs, even for the analgesic or the antibiotics. They are very difficult situation.
Thanks so much for sharing your experiences. In one of the earlier slides, you said that your organization was also supporting children to have pathways into education who have been displaced. And I wonder whether in Thailand, in those border areas, there is support from the government for children to have rights to go to schools within Thailand in those areas, or are these separate schools that you've had to establish and support?
Thank you for your question. So there are public schools in Thailand. So Myanmar migrant children can get access to those schools with some limitations. But so that many of the stakeholders, including I mentioned the Dr. Cynthia, they are trying to get migrant school. They are talking Myanmar with Myanmar language. So there are about, I think, nearly about 70 schools, migrant schools in Thailand border areas. So there are some recognition by the Thailand government they have, but with some political changes, the school situations are not guaranteed and not a sustainable approach. But the project we have supported is that although they are the schools of, they have attending the migrant school, their parents are former government employees. They have no job, they have no income. And then also they dare not walk outside because they're afraid of the police to be detained because of the lack of documentation. They have no ID, they have no passport, so that their children cannot get access to education. So when we heard the news about their difficulties, so I talked with our organization from UK to help the children so that they supported funding, and then also we just support 1,000 baht per month to each child, so that child can be enrolled at the migrant school with a very small fees, that's about 200 Thai baht, but for monthly expense, like for the meals, stationeries, or the transportation. So the parents, when receive the funding from our organization, they can enroll at the migrant school, so they can get access to the education. That's the 1 year project in the last academic.
Other questions from online?
No. Please,
Sorry, good ours.
Yeah, thank you so much. Amazing work. Some of our LAM scholars here in Venezuela have had some success in connecting healthcare workers who migrated. And seems like you have used that model as well. I'm not sure what's the limit of that, like in Colombia, connecting back the Venezuelan doctor, not exactly, I guess, with their own patients, but through like mHealth and other ways to get sort of remote care if the internet infrastructure allows that in Thailand. I'm not sure if that's something that you can experiment with or if you have already done.
so you mean some the remote care?
Connecting the healthcare workers back, you mentioned the community health workers training program, but maybe even higher levels, nurses and doctors who have migrated from Myanmar to Thailand or other places, using them again, you have that yourself, apparently it seems, or other healthcare professionals.
Please mention again, ask again if I not answer correctly to your answer. So one of the efforts for the remote healthcare is the telemedicine, telejamma. So we have many specialists working on this platform and providing online telemedicines to the people across the country, even from the other countries, because even in the other countries, if they have no insurance and then no documentations, they have difficulty in access to education. So millions of patients within 4 years of duration, the telejamma has supported the online medical care. There are many specialties on online, psychiatrists, the obs and gynae, and then also for the abdominal GI physicians, and every specialty we have, and then also the family medicine as well. So 24/7 we are working, and that you can also learn the telejammer, TLE. I will share. I can share with the post. So they are sharing the health education post, and then also Ministry of Health is also doing that and working together with Delhi.
Fantastic.
Thank you so much for sharing your experience and for all you've done and will continue to do, I'm sure. Can you talk a little about how you make decisions as an organization about which of the many health and education and social issues to prioritize? How do you decide as an organization where to focus your efforts?
So you mean, thank you, Jessica. So you mean, how can decide for the organization focus on the health and humanitarian?
Your priorities.
Actually, I have worked in the government sector for 20 years, so that every time since after graduation, I'm thinking about my country. So I will work my country till retirement, or after retirement, I can do for my country, because I know that, my country health situation is very low. So we have to work a lot for the country. So I have much empathy for people, and then as a health professional, I'm also thinking. So my sister is also a health professional, and she was a famous public health director in immunization program. She was detained by the military. So both my sister and I always thinking about to improve the health status, to work for the people. So when I have to leave my career profession, so I feel so sorry because actually I haven't decided to work in the other private sector or the other non-governmental sector. So I haven't thought of that before. But as a displaced person, so when I arrived to Thailand, so I feel so depressed because I cannot do for the people as I intended for a long time. So, but I realized after some days when I see the people in needs, so I see the people who have no documentations and then who have no access to health care, and then the children has no access to education. So, I am a public health professional, I am a medical doctor. Although I am facing some challenges, I lost my family members, or I mean that lost means that and she was detained. I have lost my property, and then also I have to leave my job and professional career. I'm alive, and then I can do for the people. So that I'm thinking, and then I'm talking with the people like Dr. Cynthia. She has worked tremendously for the people in the displaced area for 3 decades. So that I'm thinking I can do for the people. So, but in Thailand, although we are medical doctors, we cannot cure patients because of very limited licensing and recognition by the Thailand government to the foreign doctors, so that we cannot cure the patients. Although for the Myanmar community, we cannot. And then also, there are many limitations in the other professional sector in Thailand. So that, but we can work as a non-governmental organization. So we heard that some of the hospitals need medicines and equipment in the border area. So I talked with another colleague from the INGO. So can you provide some medicines and supplies to those hospitals? So he knows we work and he works for the Myanmar people. So Dr. Cindy, if you lead the organization, if you can work on behalf of your people, I will support you. So that by using my image as a government official who has worked for my country with sincerity and honesty for many years, and then I have many partner organizations and INGOs working together for decades, so that they trusted me, and also we have decided to support me, so that I have to, not by election, I have to lead my organization because of the current needs for the people, so that I have to lead my organization and then support the people in needs. The needs of the displaced community are starting from the basic needs, health, education, development, every sector. But it depends on the funding, it depends on the resources that we can get, and then also on other situation in the conflict areas, in the border area. So we have to adjust, we have to redesign, and we have to get ideas from other stakeholders and work with my team. So at first, my organization is only one medical doctor, only one staff. I have no money to pay salary to the staff. But now I have more than 50 health staff. They are CDM medical doctors, nurses, and health assistants working inside the for the people inside the country, and also for the people in the border areas.
Any other questions?
Yes.
Hi Cindy, thank you for sharing your experience. It's really brought me back to growing up in Sierra Leone during the war, and I'm really sorry that you people are going through. I can't imagine. Well, I can imagine, but I really would like not to. I wanted to ask the community that you serve, the ones on the border. You said about 200,000
Yes.
people. They are on the border, but they access most of their services in Thailand, including the schools and health services.
Access, but some limitations.
Limitations, okay. I was just wondering how are they, should I say, received by the Thailand people? I ask because I mean, when we had a similar problem and many of us had to move to Guinea and lived in Guinea for a while, and some days we considered it worse being in Guinea than being in Sierra Leone during the war because of there was a lot of tension with the local people. The language barrier didn't help. We were seen as, foreigners who've come to take things from Guineans. So I'm just wondering, how is your organization dealing with that? Are the people facing this? How do you cope with that? Is there added insecurity from the Thailand side as opposed to the Myanmar side? And how do you cope with these things?
Thank you so much, Shanika, for your question. So, at this point of time, I would like to mention my sincere thanks to Thailand people because of their warm welcome to the people of Myanmar. They know very well about the situation, and then most of the people, I think, about 99% of them, they have no negative opinion about Myanmar. So I'm so surprised and grateful for Thailand. So I work in Thailand for nearly 3 years. So I have many Thailand friends. Although we have language barriers, they always talk in Thai language. I always talk in English language, but we can communicate. We can communicate by smiles and then the other communication. So that I noticed that the Thailand community, they are I mean that their opinion and their response about the influx of migration of many people. It's very important for our people to survive in Thailand. Although the authority has some power and then also to detain some of the undocumented workers and the other people. Actually, there are many undocumented. If the police has to stop the people, it cannot be, it cannot be ended because many of the people are, I think that more than 70% of the people are in the Thai border in Tak province where I live in. So that's why we can live, and then also we can get help from the Thailand people. And another thing I'd like to mention is how I can lead the organization with these security challenges. At first, many of our staff members have no documentation. So I always arrange every day to remotely or the 1 day per week or the others. So some of them have documentations, but many are not. So that we have to arrange for some HR management every day because of the fluctuating situation by the Thailand authority. Because for the politics, Thailand authority has to deal with the Myanmar military, so that many challenges by the people day by day. But one of the support we can give is by making some documentation by the Thai government to the medical doctors and nurses in my organization. Just it is like the labor card, like a labor, but the police cannot detain. It is official and official ID for them. In the ID, they are not medical doctor and nurses. They are just the maybe worker or the factory worker or the manual worker, but they have documented, so they can live with legally in Thailand. So that we have supported to our staff members like that, and then also we have ethnic health organizations. They have a background of the ethnic army in the border areas in Myanmar side, so they have close relationship with Thai authority. So we can coordinate with those organizations to get access to the transportation of the medicines and equipment across the border from Thailand to Myanmar, and then also the patients from them to Thailand if they need specialist care in Thailand hospital. We cannot refer to the Mandalay Hospital, Yangon Hospital, where the equipments are well set. So we have to refer to the Thailand side. So we have some collaborations, Med-Doc Clinic and other ethnic health organizations with Thailand hospital sites. So we have good communication and collaboration.
Okay, I think we're at time. Thank you so much.